Good afternoon, everyone. My PhD topic is Complementary and Alternative Chinese Medicine in Pediatric Oncology. My name is Ximeng Li. My supervisor is Nicole. My SMS are Li Ximeng and Mark Hanedofree. My statistician is Li Ximeng. My vision is to improve the quality of life of pediatric oncology patients during and after treatment. My mission is to confirm the efficacy of traditional Chinese medicine and promote the use of traditional Chinese medicine complementary therapies. For this, I have two specific goals. The first one is investigating the addition of complementary Chinese herbal medicine among pediatric oncology patients treated with conventional therapies. It's a systematic review and meta-analysis. There are four main methods of traditional Chinese medicine: acupuncture, manipulative therapy, cupping, and herbal medicine. Our article will only focus on herbal medicine. Chinese herbal medicine offers a personalized and holistic approach to pediatric healthcare. Our aim is to investigate the effect of additional Chinese herbal medicine therapies in pediatric oncology. Our clinical question is, does additional Chinese herbal medicine therapy change the effect and the toxicity of conventional therapy in pediatric oncology patients? The hypothesis suggests that the Chinese herbal medicine can improve survival rates and reduce the side effects, potentially influencing the clinical guidelines in oncology. This is my search key. I used both English and Chinese databases. After the selection, we have 67 eligible articles. All of them are RCTs. Let me discuss about the summary results. This is figure 1. It shows the complete and the partial remission rates and recurrence rates comparing Chinese herbal medicine-treated patients to those receiving conventional therapies. Our study conducted subgroup analysis based on different tumor types, various follow-up times, and different types of prescriptions. Subgroup analysis was performed on single prescription with sufficient number of studies. Complete remission rates were higher in Chinese herbal medicine group. For example, in the patients using immunity-boosting Chinese medicine, the odds ratio was 2.19. Complete and partial remission rates are also higher in Chinese herbal medicine group. For instance, the patients using tonifying and replenishing Chinese medicine, the odds ratio was 2.93. Recurrence rates were lower in Chinese herbal medicine, with an odds ratio of 0.25. These findings suggest that Chinese herbal medicine may improve the remission rates and lower the recurrence risks. This is figure 2. It shows the hematological and the immunological parameters of Chinese herbal medicine-treated patients compared to controls receiving conventional oncology therapies. For the hemoglobin levels, the Chinese herbal medicine group had the higher levels. For example, in the patients using Shenqi Fuzhen injection, the mean difference is 21, indicating a significant improvement. Platelet counts also were higher in Chinese herbal medicine group, with a mean difference of 17.02. The Chinese herbal medicine group had a higher proportion of CD3 and CD4 T cells, suggesting that enhanced the immune functions. These findings suggest that Chinese herbal medicine may improve the blood and the immune health. This is figure 3. It shows the incidence of various adverse effects. The infection rates are lower in Chinese herbal medicine. For example, in the patient using tonifying and replenishing Chinese medicine, the odds ratio was 0.36. Nausea and vomiting are also lower in Chinese herbal medicine with an odds ratio of 0.42. There were lower risks of liver damage in the Chinese herbal medicine group with an odds ratio of 0.46. These findings suggest that Chinese herbal medicine could reduce the incidence of several adverse effects. In conclusion, Chinese herbal medicine can greatly improve the complete remission rates and reduce the side effects of conventional therapies. The result of this meta-analysis suggests that traditional Chinese medicine could be a valuable addition to pediatric cancer treatment. However, more research are needed in how traditional Chinese medicine is used in practice. Future studies should focus on finding the best dosage, timing, and combinations of traditional Chinese medicine in treating children with cancer. Additionally, the studies in different cultures and multiple centers are needed to confirm the effectiveness and the safety of traditional Chinese medicine in various patients groups and healthcare settings. For the strength is the first comprehensive meta-analysis focusing on the use of Chinese herbal medicine as an adjunctive therapy in pediatric oncology. We included data from 55 RCTs and it covering 29 prescriptions and 136 substances. However, our result may not apply to everyone since all studies were conducted in China. Also, the differences in the study design, especially in the Chinese herbal medicine, how Chinese herbal medicine were customized in each patient, create challenges in comparing the outcomes. Our manuscript is under the inter-review. Our target journal is Cytomedicine, which has the impact factor of 6.6 and is ranked in DD1. My second topic is safety and efficacy of turmeric extract and curcumin supplements in malignant oncology disorders. Curcumin is a fat-soluble compound from turmeric. It is safe and well tolerated in humans and has been used in several clinical trials. Our aim is to investigate the effects of addition of curcumin in pediatric oncology. Our clinical question is, does the addition of curcumin to conventional therapy change survival and side effects in pediatric oncology? The hypothesis suggests that the addition of curcumin to conventional therapy could improve survival rates and reduce the side effects in pediatric oncology patients. My first project is planned to be submitted on September. Thank you for your attention. I would like to close my presentation with a quote. Keep your face always towards the sunshine. The shadows will always fall behind you.
Thank you. What is different from progress report 6, progress report 4, that in complex exam there are more questions, but pretty similar structure. So if I can start the questions that also, both in your manuscript and your presentation, that you actually use two terms, Chinese herbal medicine and traditional Chinese medicine. So are these things the same exactly?
Actually, no. Traditional Chinese medicine contains a lot of different methods, but the Chinese herbal medicine are the most commonly used in traditional Chinese medicine.
Okay, so Chinese herbal medicine, is this one kind of mixture of certain well-defined herbal components?
Sorry?
So chemically, are all Chinese herbal medicine is the same chemically?
No.
So even that is a mixture?
Yeah.
Now the reason why I'm asking, because if we go back to your one of the forest plots, there is quite a few, and it looks to like here, for example. It looks to me that in some studies, I mean, there is an effect on the right and there is an effect on the left. So therefore, it could come actually for multiple kind of reasons, but one of the reasons could be if they are actually different kind of mixtures. So what do you think about this? What is the cause of the heterogeneity?
I'm sorry.
Why do we see quite different results in different studies? Because this is what we call heterogeneity. You see here, these two is on the left, this many on the right, and then there are a couple of ones with actually more or less in the middle. And the outcome is quite different.
So it depends on the value. Is it higher or better, or lower is better?
Yeah, I understand that, but I don't understand the difference. Or what is the hypothesis? What do you think? That why in some studies it is better, and then some other studies that is worse actually than the control?
But in all the studies I included, they have the same definition.
Yeah, but you just said that not only all Chinese herbal medicines are exactly the same by components. Am I right? I mean, China is big, to my best understanding. I mean, this is a kind of in different parts of China. I assume that Chinese herbal medicine contains different kind of herbal components. Is this true?
Yes.
So this could be one important reason, but that also gives a big limitation actually of such studies, I think.
Yes, we made the subgroup depend on the different prescriptions functions. For example, the heat cleaning or the immune boosting is the types of different prescription.
Yeah, the other thing, what I just wonder that you said that you searched for both non-Chinese and Chinese literature. So are there kind of, you didn't do subgroups on that, and the letters are just too small, I mean, to me to see. In general, is there a difference between Chinese studies and non-Chinese studies when they use actually Chinese herbal medicine?
Actually, all the studies are conducted in China.
Okay. So no studies outside of China?
Okay, my second question is related to the previous one, so I start with this. All studies were conducted in China, but my question is there are no studies at all in Taiwan, Hong Kong, Macau, Singapore, your hometown, which is not mainland China, but they are inhabited by Chinese people. You don't have any study from Taiwan or Hong Kong or something like this?
In my article, no. Actually, there are some articles, they also investigated the Chinese herbal medicine, but they are not RCT, so I didn't include them. And those articles, some of them are from Taiwan or Hong Kong, but they are not RCT.
Okay. And my other question is, do you have any data regarding the influence of traditional Chinese herbal medicine regarding the pharmacokinetics of the different pediatric oncologic drugs, like influencing the absorption or metabolization or elimination of these oncologic drugs? For example, curcuma or other traditional Chinese drugs. Can they influence the pharmacokinetics of the classical drugs used in pediatric oncology? Like
Interactions.
Like curcuma can improve the absorption of whatever oncologic drug, or worsen the absorption, or improve the absorption. Do you have any data about this?
So you mean the data of the Chinese medicine, how improve the conventional? therapy.
Yes, how they improve the conventional treatment by influencing the pharmacokinetics, the movement of the drugs in the body, the journey of the drugs in the body.
This is what you study actually in general, but this is about the mechanisms of action. You see, what is the mechanism of these Chinese herbal drugs? I mean, we could answer that in this way. Do we know about the mechanisms of action? I mean, so this is probably a kind of complex thing, but do you know anything about that? Because that, a part of that is the pharmacokinetics, for example. So this is why we ask. So probably you saw actually many papers like that, but what is the idea about the mechanism of action? How does it act? What is the target, for example, in oncology? So why do you get actually a kind of positive effect? You don't have to say the absolute truth. I mean, just we would like to see what is your opinion about this, if you have, of course. I mean, you should have.
As I remember, I saw some literature that they say the Chinese herbal medicine could improve the T lymphocytes and NK cells.
Yeah, so some inflammatory cells. You mean that, but again, what is the mechanism of action? Is this receptorial or activating something which then affects something else? Because then, obviously, I mean, some of these should affect the pharmacokinetics of other used drugs too. I mean, this is one of the big problems in today's medicine. I mean, the interactions between different drugs. If we could figure out how it happens, I mean, we could, that is called actually personalized medicine, but we are not quite there. I mean, we are talking about this always, but that would be good to get a kind of a good vision, a good view on that. But for that we need to see the mechanism of action. I mean, what you said is good. I mean, that's already something. I mean, that some inflammatory cells are affected. So they are activated or inhibited or what? Do you know? No. Okay, more questions, please.
I think it's a heroic effort that we've just seen, that you wish to study this topic, and a big up to you and to the statistician and to the SMS and to the supervisor and everyone, because I think it's just wonderful that you could actually come up with the subsets. Like, you could actually make some homogeneity within this, like, general term herbal medicine, because we all know that means like hundreds of plants with the many different mechanisms of action. So first, like, I mean, I'm amazed. A second, and a slight addition. There were no forest plots, in this presentation whatsoever. These are summary plots. I mean, imagine that you cut down the pooled effect size of all forest plots and you glue it to a piece of paper, and that's what you get. So these are all the pooled effect sizes of the outcomes. Okay, so it's not a forest plot, it's a summary plot, we used to call it. I'm just wondering what the conclusion of your manuscript has. So if I tell you that if I read your paper, can I have some sort of insight if my child is 6 years old and has brain cancer, which herbal medicine shall I take? Or these are, let's say, a specific, so something for the immune system or something tonifying will just will have a beneficial effect regardless of the type of cancer my child has, regardless of the age of my child, regardless of the gender of my child, regardless of the state. You know what I mean? So were the oncological diseases similar within at least in one study between the control and the intervention group?
Yes, most of the study they use the same dosage and the same herbs for every patient. But actually, in in the Chinese medicine hospital, most of the time the doctor will customize the formulas.
Yeah, that's what I was. And what about the underlying illness? So what about the types of cancers? Were they similar in the control and the experimental children? What their cancer type was? What kind of cancer they had?
Most of the cancer are leukemias.
Leukemias. Okay, and you study lymphocytes and like leukocytes and like the receptorial stimulation and stuff with leukemia. Oh, that's just great. Just one more thing. What's the Shanky Fuzhang injection? Do you know what that is?
I know it. It contains a lot of different herbs, so it's a little hard to translation in English.
Just the contents.
So the main function for this mixture is to restore the body's vital energy. We call the qi in Chinese.
Yeah, the qi. Oh, great.
Yeah.
So it's a cup of a secret ingredient. Great. Okay, and what do you see? So it's just the last one. So what's the attitude towards traditional Chinese medicine in the Western world? What are your based on your readings and maybe experience?
So sorry, can you repeat?
Is traditional Chinese medicine, especially herbal medicine, let's say, emerging in Europe and in the USA, or only within the Chinese closed communities? Sorry, communities without the closed, but we know that they are they keep together. Or is it any let's say observational studies or non-RCTs that was conducted in Europe, perhaps? So do you think that Europe wishes to open to traditional Chinese medicine as a way of healing?
Yes. As I know, there are a lot of limitations for import the herbs from China.
Oh, yeah, I see, yeah. The lobbies, okay, yeah, okay.
The application is not that easy because, in Europe, because, you have to have lots of studies in before. So if I can ask a somewhat easier question, that you probably compare, your studies, you have different kind of cancers. Did you see difference between different kind of cancers? Like lymphomas or whatever, or solid tumors or whatever in the response to Chinese medicine? Different kind of tumors. You put all tumors together.
No, we made the tumor types, the subgroup based on tumor types.
Okay, and then what did you get?
So most herbs are more effective in the patients with solid tumor.
Solid tumors.
Yeah.
Do you have any idea why is it happening? Again, you don't need to say the absolute truth. Just what you think about this.
So I think it's more easier for those patients to get the balance through the Chinese herbal medicine. Chinese herbal medicine, so there are some concepts about Chinese herbal medicine. It would like to make a balance of the different organ in your body. So I think maybe the solid tumor is more easier for getting balance from Chinese herbal medicine.
I would like to join my colleague in supporting you, because I think this is something that has the potential, but we need to overcome some hurdles on the way from Asia to Europe. But then again, to start a therapy in a patient, you would usually need to make sure it's safe and it's effective. And that is why we're asking these questions about pharmacokinetics, about interactions with what is available. And within oncology field, which I feel is a good field to start the study, I'll tell you something about heart failure in a second, is the fact that in oncology, we are sometimes a bit desperate, in particular if we're dealing with children, and more things are allowed. But then again, I would also support the discussion in the following points. I would be interested to see which cancers have you studied, did you study? Were there any differences between the types of cancer, the therapy that was basic therapy for the cancer, the staging of the patient, and then to see what type of therapy did show potential effect, what was the dosing of traditional Chinese medicine, and when did you start? So that would then open new things, because I'm now going to the heart failure, which is my field. Last year at the ESC, it was the hotline session. It was the presentation of the QUEST trial. 3,000 plus Chinese people, also from Hong Kong and Taiwan. The trial was positive with something I cannot read, the Chinese name. I will not read it because I'll embarrass myself. And that drug, that medicine contains 13 individual compounds. So which one is working is the question. In the end, trial was positive, okay, that's fine, but are only 7 effective or only 1? Is 1 harmful? So that is the thing I think you need to be very careful in the interpretation of your results. And I feel that it is publishable, but not at the stage you are now. So maybe you should read this paper on heart failure too, because it was published in Nature Medicine eventually. Not a bad journal, but in methodology, many things that are unclear, including what is actually the active compound. So these would be my comments.